Hello, everyone. As you're coming in, we're welcoming you to a wonderful webinar today. We'll just give it a couple seconds for people to come in. And we're going to start in just a couple seconds. Let me just double check that where our attendees are in. All right. We're still having some attendees file in, so I'll let that happen while I go over our information at the beginning of our webinar. My name is Marcia Butler. I am the webinar director here at Advice Chaser. Before we introduce our guests and get started, I do need to do a bit of legal housekeeping. Advice Chaser, the host of this webinar, is not a registered investment advisor. We cannot and do not give financial advice. Today's presentation is for educational purposes only and cannot be considered advice for any person's individual situation. Advice Chaser regularly hosts informative webinars, such as this one, featuring a variety of knowledgeable professionals, many of whom are licensed advisors. Any opinions, ideas, jokes, or principles expressed by the presenters are their own, and however true, funny, or interesting are not endorsed by Advice Chaser. Please do not act on the information you hear today without consulting a qualified financial professional. We're thrilled to bring you this lunch hour educational presentation. Attendees are muted, but we encourage you to ask questions using the chat box. The presenters will answer those queries after the presentation today as appropriate. And if you ask a question in the chat box, go ahead and leave your phone number as well. If we can't get to your question during the event, we'll make sure someone reaches out to you after today's event. We want this experience to be as educational as possible, so please don't hesitate to ask for clarification or expansion of the material. Today, I'd like to introduce you to the moderator, Alex Polowski. Excuse me, Alex, I didn't mean to butcher that. He's the president and founder of Basic Concepts Financial Services, LLC, and has been a licensed professional in the insurance business since 1989. His expertise is in financial planning for both businesses and individuals. He is a registered representative of Horner, Townsend, and Kent, and a member of FINRA and SIPC. Alex is also securities licensed in the state of Pennsylvania. Along with financial planning, Alex is health and life insurance licensed in Pennsylvania, Ohio, West Virginia, and Virginia. He also works with small to medium-sized companies for medical, dental, vision, voluntary benefits, FSA, HSA, HRA, COBRA, 401k plans, and self-funding medical, dental, and vision benefits. Today's presenter is Lee Kruger, who is the founder and president of CareRight Inc., the concierge of senior care planning. Let me go ahead and get some pictures up here of our panelists today. And I'll go back to a little bit about Lee. CareRight assists families in navigating the complexities associated with the aging process by managing crisis situations, developing a proactive aging plan, and facilitating family meetings and providing needed support to struggling caregivers. For Lee, providing proactive senior care planning to families is more than just a career, it's her passion. Lee has spent her entire 27-year career in the senior care industry and has become a nationally recognized expert in the field of senior care planning, and having presented a number of healthcare, senior housing, and financial conferences, as well as hosting dozens of webinars. She received her BS in social work from the University of Northern Iowa and her MBA from Cardinal Stretch University in Wisconsin. Lee is a certified family mediator with further certificates in grief, trauma, and loss, as well as PTSD counseling. Lee is the author of The Invisible Patient, which comes out later this year, and outlines the emotional, physical, and financial toll experienced by family caregivers. And Alex, I'll have you go ahead and go on, unmute yourself and just say a little bit of what people can do if they have questions, just remind them again.
Okay. Thanks for joining us, everyone. Please note you have a chat box. It's usually sitting there at the bottom of the screen. If you have any questions, please type them in there. We will wait to answer those questions to the end of the seminar. And again, if we run out of time, please let us know that we can return your calls. Just get back to Advice Chasers with the contact information, and we'll get back to you with any questions you may have. Thanks. Bye-bye.
All right, I think we're ready, Anna Lee, for you to go ahead and take over and share your screen.
All right, you can start screen share. Okay, there we go. All right, let me make us all small. Okay, hi everybody. Thank you for taking your lunch hour and spending it with us today to learn about difficult conversations with aging loved ones. Real quickly, my why I started CareRight. I was a social worker and administrator in long-term care for 18 years. And every day I had families in my office because there was a medical crisis. And the families would literally come in the door with a whole list of facilities that they were supposed to check out by noon tomorrow because their loved one was being discharged from the hospital. The tour would take about an hour, but I was spending 2 and 3 hours at a time with families because they had no idea what questions to ask, what to look for during the tour. They had no idea if their parents had living wills in place, long-term care insurance in place, funeral arrangements taken care of. They don't know who's going to pay for care. They think Medicare is going to pay for everything. So, and then there was a lot of family dysfunction. You know, our family never got along, and now mom's dementia progressed, and we're supposed to work together as a family, and we've never done that. So why would we start doing that now? So there's just a lot of psychosocial issues with families, and they really were unprepared. They were blindsided by the health crisis and realizing that they've never talked about any of the what ifs of aging. So in 2011, I started CareRight Incorporated and went nationwide in 2012. So I've been virtual since 2012. So thankfully, it did not take the pandemic for me to have to pivot with my business. I've been able to help families across the country and join in their journey and facilitate their family conversations. Why don't families have these conversations? I can tell you most families do not have these difficult conversations. Why? Because the topics are uncomfortable. They aren't sure how to start the conversations. It's hard to say, hey, Dad, I noticed that you're incontinent. Maybe you should wear, it depends. It's very hard to start these difficult conversations. Families usually don't know what to discuss. They do not know how to communicate effectively. That said, 92% of my clients come to me in crisis. 85% of those families, because by the time they come to me, they're burned out. Caregivers, their family relationships are so strained all across the board that families just aren't even getting along. So they don't know how to communicate effectively. I do mediation with most of my families. They don't know enough about aging, dementia, care options, and how to pay for care to be able to facilitate their own family meeting. And most families, because of family dynamics, they need a neutral third-party person to facilitate their family meeting. And again, a lot of things boil down to family dynamics. If you didn't get along for the last 10, 15, 20, 30 years, the aging process is probably not going to improve those relationships and communications with each other. So why are conversations and planning, why is that all critical? Because the aging process is bumpy. We know that people are in and out of the hospital. We know that falls happen, dementia progresses, other chronic conditions get worse. So it's bumpy. One would hope the aging process would bring families together, but I'm here to tell you that it often does the opposite. So those of you that are listening or watching this webinar, think about your own families and how would your family hold up if there was a medical crisis. Conversations and planning are critical because it improves your family relationships and it can avoid caregiver burnout. You end up with better health outcomes. You end up with better care outcomes. You have peace of mind as family. And as a disease and dementia and aging, that progression is inevitable. So it's going to happen. So we need to talk about it and plan about it, put a plan in place. It is expensive for adult children to ignore aging issues. Family caregivers are leaving the workforce in droves to become family caregivers. Family caregivers are financing their loved ones' care. Families are blindsided when a medical crisis occurs. Now, what do we do? When you look at the financial impact of caregiving, Genworth did a study in 2018. 46% of family caregivers worked fewer hours, 30% missed career opportunities, 63% were paying for their loved one's care out of their own funds, 42% reduced their contributions to their own savings and retirement. Most family members end up quitting their jobs or taking early retirement, and you're not getting paid as a caregiver. Another study showed that 58% of adult children find themselves thrust into the role of caregiving without ever having any kind of family meeting or discussion. Another survey found that 48% of seniors do not follow through with hospital discharge instructions. They're too ill, they might not have transportation, and there's probably no family around to help coordinate those appointments that they end up with and medication changes from a hospital stay. The prevalence of dementia also cannot be ignored. According to the Alzheimer's website, Alzheimer's and dementia deaths increased by 16% since COVID-19 pandemic. More than 5 million Americans are living with Alzheimer's, and by 2050, it's projected to be nearly 14 million people. 2020 healthcare costs to the nation $305 billion, but by 2050, it's projected to be $1.1 trillion. There are over 16 million Americans who provide unpaid care. Caregivers provide an estimated 18.6 billion hours of care, and that's valued at nearly $244 billion. So aging and dementia and Alzheimer's are very expensive diseases, and we have to start having conversations as a family about the what ifs and what is our actual aging plan. Effective communication is the key. Most families do not communicate effectively. Most families live in different states, and no one really knows what's going on with mom and dad. Mom and dad might be embarrassed that they are struggling, and they do not want to bother the kids or be a burden. And the parents tend to paint the rosy picture. Siblings may not communicate or get along. 25 years ago, when I first started as a social worker, I could easily go to Ethel and Marvin's house and gather around the kitchen table with the adult kids because everybody lived near each other. But as time moved on, or as time moved forward and families started moving away from each other, if siblings and family members did not invest the time, the effort, the energy, the resources, and the investment of maintaining their relationships with each other, then when that medical crisis occurs, the family has to get reacquainted as a family and then figure out what the options are. And in a crisis, you don't have the luxury of time for that. Blended families often do not even know each other, especially if Ethel and Marvin are a new marriage and they're in their 80s and they've only been married 5 or 10 years. The adult children might not even have relationships with each other. And then when, Marvin has that stroke and Ethel is now his caregiver, Ethel's kids they're not on board with that. They're like, I'm not going to let your dad kill my mom because of caregiver burnout. So it gets really dicey sometimes with blended families if there's never been a family meeting. If there's a history of poor family relationships, aging certainly is not going to improve already strained dynamics. Everyone has their own relationship with each other. Everyone has their own perception of how bad mom and dad are doing. And everyone has their own idea of how their inheritance should be spent. So there's a lot of family dynamics that get involved and impede effective communication. And also, I work with a lot of families who don't have any kind of communication system in place. Like they're not having frequent family meetings. They don't have a like a Facebook family page where they can share information, or Google Calendar where they can keep updated with doctor's appointments, so that they can either participate in doctor's appointments as a family, or at least that's a good communication tool. And some families use like Dropbox or Google Drive to keep updated with notes and doctor orders or falls or weight changes and those kind of things. So those are good family tips on how to communicate. Points to ponder. I'm not going to go through all of these. There's 2 or 3 slides of the points to ponder. But these are just things that the hope would be that you realize, oh my goodness, there is a lot to have to think about when I have aging parents, or if I'm the one that's aging, if I'm the mom and the dad, what do I need to be thinking about so that I don't end up a burden on my children? So a few of these points to ponder: what is working well right now? What is not working well? What are the goals as we age? What are our finances and what can we afford for care? What are our options based on our care needs? What if I need a different level of care than my spouse? My loved one has dementia. What should we know so we can better prepare? My husband's dementia is worse. He is wandering, agitated, paranoid, and is not sleeping or bathing. Who will make sure the primary caregiver has enough supports in place to avoid burnout? What is the plan if the primary caregiver takes ill? Or if you're the daughter, I'm the daughter caregiver and I can't keep juggling all of my responsibilities. 3 or 4 off of this slide of points to ponder. How can we best support our aging loved ones despite COVID and long distance caregiving? What do I want for quality options and quality of life? Our family doesn't get along now. How will we handle a medical crisis? If I'm married, do I want to be on the same campus as my spouse? Will the community have 2 openings if we both need different levels of care? Will I be satisfied if we end up wherever there is an open bed because we didn't plan? And the big question here is really, what keeps you up at night? What worries you? A couple off of here: I'm the out-of-state son and daughter to aging parents. How will I manage a medical crisis? Am I in a financial position to leave work for a period of time? Is my spouse supportive of my crisis trips? How is my own health holding up? And is your employer family friendly? If you're in sales and you're not hitting your sales goals, they might say, well, you know what? I'm sorry, Sally. Sounds like you need to get your family squared away, but we can't keep you on our payroll. So really think about how much can you afford to not address these aging issues. What if you're not wired to be a caregiver? Or what if you're an only child? Who are you going to lean on when the aging process occurs and there's a medical crisis? And what if dad is not safe to drive anymore? So let's look at Hurricane Irma. So I live in Florida, and I came from Milwaukee, but of course, 6 months before I moved down here, Hurricane Irma hit. So Hurricane Irma, the adult kids flew their loved ones up north. And keep in mind, I do 30-minute consults. I do a complimentary consult with families just to hear their situation and how I can help and add value, and the value of an aging plan. So all these kids were like, oh, mom and dad are doing fine. They're doing good enough. We'll be down after Christmas to check on them again and talk to them about putting a plan in place and having you facilitate our family meeting. So I'm like, okay, but now is the time to plan when you're not in crisis. So they're all banking on December. Like, we want mom and dad to have a good Christmas. And then in January, we'll talk to mom and dad about all this aging stuff. Well, guess what? The hurricane hit in September. So so these kids flew their loved ones up north to get out of harm's way. And the kids started calling within a week of their parents being there. My phone literally rang off the hook, like in the old days when the phone was actually still on the wall. The kids were blindsided by how poorly their parents were doing. Their parents were there for a week before they realized, oh my gosh, dad never took his pills. We didn't know that he needed reminders for that. Or we didn't know that mom was incontinent. Now our house smells, of urine and BM. Kids were surprised at how demented their parents were and how forgetful, and how they needed a lot of cueing and redirection and reminders. And then they were really blindsided too by just how generally frail and how they weren't eating well, how they had lost weight from their last visit, and just not getting around the house very well. So those were some really big eye-opening experience, or that Hurricane Irma was a big eye-opening experience for most families. And it kind of forced them into having these family conversations and addressing the reality of their situation and putting a plan together. So we're going to talk of all those slides of the points to ponder. You could, and that was just part of the points to ponder. There's actually like 40 bullet points that I have that I go through with families, but we're going to just focus on 5 common issues that families encounter. Number 1, reoccurring medical crises or back-to-back crises. 3 years ago, I asked my adult daughters, because that's usually who reaches out to me, because she's about ready to lose her job. Her marriage is on the brink because the husband was only supportive the first 2 or 3 crisis flights at $1,000 a pop for airfare. And so I asked the families, how much money did you spend just in travel for crisis? You know, plane, car, gas, renting cars, having to rent a hotel because you don't get along with your parents, or their house isn't kept up enough that you want to stay in there. It was $15,000 the year before they hired me to put an aging plan in place. And that's all out of pocket. You don't get reimbursed for that. It's not paid. So common issues that families call me about is, we can't go through another medical crisis. We are so ill prepared. Every time there's a crisis, it's just that much worse. And of course it is. We're also going to talk about a grab and go binder where you can put important documents. Where are the documents? What is in place? What do we have already for plans? Where's our long-term care insurance policy? Who's our financial planner? Who's our attorney? Who's our CPA? What do we have for funeral arrangements? Do we have our code status sheets for resuscitation or do not resuscitation? What accounts and passwords do we have? And where are all of those documents? A third situation families find themselves in is, because they don't know what they don't know, they end up moving mom and dad in with them and then find out it's not going to work very well. So that's a common issue. The 4th one that we'll cover is concern with parents living at home, because again, they're frail, they're elderly, they might not be eating well, they might not be walking around very much, so they're losing their mobility. And caregiver fatigue. All right, so reoccurring ongoing medical crisis, common issues that we see with our aging parents. They're falling, they're losing the mobility, and they're not safe at home. So maybe the house isn't safe, there's stairs, or the only bathroom is, upstairs because they live at a tri-level. Losing mobility, it's common, especially with COVID. All these senior centers, everything is shut down. The only really source of entertainment for most people is the television. And so they find themselves just kind of sitting in front of the TV in their chair and not moving around as much as they should. Dementia progression and disease progression, these are common issues that bring families to Care Right to put a plan in place. Oftentimes it'll be, mom is taking care of dad, he's got dementia, he's getting aggressive, he's refusing to eat, or he's getting paranoid, he's getting argumentative, and it's hard for mom to manage that. Or he wanders out of the house and gets lost. So there's a lot of issues with dementia progression. Other common issues, just frail elderly loved ones. They're getting elderly, they're not taking good care of themselves, and they need to have some care oversight to make sure that they're getting to their doctor's appointments, make sure that they're taking their medications, make sure that they're eating and drinking and getting enough socialization. Urinary tract infections and other infections. I've had hundreds of families, because they don't understand aging and they don't understand how one infection can really impact their parents. They'll call me and they'll say, oh, mom needs to go to a nursing home. She's just like suddenly confused and she can't do anything for herself. I'm like, whoa, let's not push the nursing home button here. Let's get her evaluated. And lo and behold, they almost always have a urinary tract infection because they're not eating enough. They're not keeping themselves clean and dry. Pressure sores are a problem. Frequent hospitalizations, in and outs of the hospitals gets elderly people pretty discombobulated, especially if they have dementia. weight loss, poor nutrition, not taking their medications, and they're missing doctor's appointments. If this rings a bell to any of you, we probably should talk because this can be prevented if we get services and get a plan in place sooner rather than later. So how to have the conversations about these medical crises. These are just little scripts for you to think about and pick which one works the best for you. But Mom, I worry because you have been in the hospital 3 times in the last year. I love you and I want what's best for you. It's important to me that you have as much say and give as much direction as possible so we know what your wishes are. It doesn't seem like things are going as well as they could be, and I'd like to discuss some options. I'd like to learn what you already have in place, like documents, insurance, accounts, or passwords, and ideas you have for if more help is needed in the house. Have you thought about having someone come in and help with whatever, safety, falls, meals, walking you? I would have so much more peace of mind if, and then you fill in the blank, was in place. How can I or we as a family better support you? I'd like to work with a professional who can help us sort out our options. So those are some different ideas and sample scripts for at least you to get the conversation started. So documents, the second common issue, what documents are in order and where are they? Most families find out during a crisis how ill prepared they are. What documents are in place? Where's the living will? Where's the power of attorney? What do we have for insurance? Mom needs care. How is that going to get paid? Where are the documents? Some of my clients will say, well, we have it in a green folder that says like, if something happens to me folder, and it's in the top drawer of my dresser. So that's kind of their system, if you will, for documents, but that's not adequate, because if the documents are never communicated with to the adult children who are the decision makers or the power of attorney, and you've never had a conversation about this is what we have in place, these are my wishes, these adult children are going to have no idea what these documents really mean. Where are your accounts and passwords? If you've been assigned to be the financial power of attorney and your dad has a stroke and he's no longer able to communicate, and then that's usually when adult children find out that they're the power of attorney. Well, if you're the financial power of attorney, how are you supposed to do your job of taking care of the bills if you don't even know what accounts and passwords and where the banks, where the checkbook is and what bills you have? You're going to not be set up for success. What are your end of life wishes? What insurance policies are in place, like long-term care insurance, life insurance, hybrids? And even with the insurance part of the grab and go binder, car insurance, house insurance, flood insurance, all things insurance need to go in the insurance tab. Do you have all of the information you need in case of an emergency or death? Safety deposit box, code to the cell phone, and military discharge records are common misplaced or non-communicated items that families will need at some point. So how to start the conversation about documents and where they are? Well, there's a grab and go binder that I've created for families to get all of their important documents and facilitate these conversations. So there's a plug and play system that's already ready to go for those that are interested in that. But otherwise, you can say, Mom, I've been thinking about who I will appoint to make decisions if I am unable. So what do you already have in place for healthcare and financial decision making? So if you kind of bring it back to yourself and say, hey, I've been thinking about this. I was on this webinar and I wanted to kind of just make sure I have all my stuff in order. What do you have in order? Again, leverage the webinar for all of these different conversations. Mom, I was on this webinar. She brought up some really good points about our family maybe not being as prepared as we could be. Let's sit down and talk about this. Another bullet point. I don't know what to do if something happens to you. I don't have any idea where any documents, policies, accounts are and what your wishes are. It would be helpful if we had a family meeting so we are all on the same page about what you have in place and what your wishes are. I want our family to work as a team. The best way to do that is to start the conversation now. And again, if most of the families I work with started doing this ahead of time or came to me prior to a crisis situation, it wouldn't be as bumpy and as rocky and as emotionally intense as it is during a crisis if we could have started working with these families sooner rather than later. So sometimes families do this because they don't know that there might be other options, or they think that it will make it easier for them as the caregiver. And in some ways it does, but these are the ways that it does not. I moved my parents in with me thinking it would be easier to care for them because then you don't have to drive 2 or 3 hours, or you don't have to jump on a plane. But soon they find that they are in over their head with caregiving. They don't realize, kind of like Hurricane Irma families, right? They had no idea that their parents needed more care, more supervision, more oversight. And so now they've got mom and dad in the house and they're like, oh my gosh, what are we going to do? They get burned out and they resent their siblings and they resent their parents, because guess what? You moved your parents in, so now they're your responsibility, and siblings don't always appreciate how much time parents can take, and parents don't always appreciate how much time they may be taking from their children. Usually when I ask moms and dads, the Ethels and Marvins, what are your goals as you age, they all say the same thing. So 25 years of the same question. I want to stay in my home, but I don't want to be a burden on my kids. But unfortunately, because we don't have these conversations and because we don't talk about the what ifs of aging and we don't have an aging plan in place, they end up being a burden, and they're not always able to stay at home because it's not as romantic of an idea. Once you're in that situation, it's not always as romantic of an idea as you'd like to think it is about staying in home. Another common complaint, my house smells and looks like a nursing home. They don't realize that when mom and dad move in, yeah, that's great if they're still active and mobile, but in time, they're not as active and mobile, and they might have accidents in their pants or on your couch, or your bathroom is no longer how it used to be before they moved in. My kids can't be kids anymore. Their noise bothers my parents. They're constantly telling my kids to be quiet, or my kids can't run around and play, or my kids barge into grandma and grandpa's room and they don't like that. So there's privacy issues on both sides of the scenario. Oftentimes the caregiver says, I have no privacy or time alone. Someone always needs my attention, time, and energy. And again, by the time they call for services, they are totally burned out. This is not working for any of us, but how am I supposed to tell my parents this? So what happens is people move their loved one in with them thinking that they'll be able to handle it, find out pretty quickly that they're in over their head, but they never had any conversation about an exit strategy. Like, okay, you can stay with me as long as you can make it to the bathroom, or you're not falling, or you don't wander out of the house, or I don't have to miss work to be able to get you to your appointments, or you can stay with us as long as it doesn't interfere with my own family and our own privacy and our own lifestyle. People do not have those types of conversations, and then they feel terrible. They feel guilty for thinking the way that they think, and it causes a lot of angst and anxiety. So we need to talk about, what is the exit strategy? So if you're already finding yourself in this situation and you're like, oh boy, give me more information about this part of it. So I highly recommend that if you haven't been having frequent family meetings, that you start right now. Say, look, we made this big decision about moving in together, but we never really talked through the what ifs and how things would really go. It's not too late to do that. So have frequent, I always encourage at least quarterly, just because I work with aging loved ones and family members, and I know things can change very quickly with their health and family dynamics. So quarterly seems to be a pretty good frequency to have a family meeting and say, look, it's not too late to, let's have some open dialogue, because you may not be the only one who's not satisfied with a living arrangement. Parents don't want to be a burden on their kids. So this is a good way to open up that conversation. So how to have a family meeting? What should we talk about? Have a round robin. Everyone gather around and say, what is working well with this situation? What is working less well? and give everybody an opportunity to say, well, I really like this and this and this about staying with you, but I really don't like this and this and this. Like with my own parents, my dad lives with me, he's 83. What I love about my dad living with me is he does all the cooking. He's still able to drive. He is able to take care of himself, and he cleans up after himself, and he's funny and he's engaging, and we have a great relationship. What I don't like is he doesn't wear his hearing aids, and that is a problem. So there's going to be things that you need to be talking about sooner rather than later, so that it doesn't end up being an unpleasant situation and it doesn't negatively impact your relationship with each other. So what supports are needed to improve our situation? Do we need to look at home care or adult day programs? Do we need to find a driver so that you don't have to miss work to go take dad to his dentist or mom to her doctor's appointment? Is meal preparation too difficult? Or do we need to really look at a move into a facility if the socialization, if they're not getting enough socialization at home and their care is compromised at home? Maybe we do need to look at other alternatives, and maybe it is moving into a care community of some sort. Do we have enough privacy as individuals and as a family? Are you able to enjoy time with friends, have friends over, or go out? Usually the caregiver, depending on where you are in your journey, you're too exhausted to even go out, and you're too embarrassed to have people come over if your house smells like a nursing home. So we really need to have these conversations now before things get worse. So you notice that maybe you're like a Hurricane Irma family. You're like, oh my gosh, I had no idea mom and dad were doing so poorly at home on their own. Typical things that we see, which are red flags to adult children, is memory or dementia progression. They're more confused or forgetful than when you saw them last. And I will tell you that dementia patients can cover very well. They can skate through a 10 or 15-minute phone conversation pretty well. But when you spend actual time with them, that's when you realize things are not going as well as you would like to think. Weight loss, depression, especially during COVID, all of these things are magnified by 1,000%. So weight loss, depression, not taking medications, incontinence, so not being able to hold their bladder and bowel, driving issues and falls are very common. And then again, the pressure sores as well are common indicators that things are not going well at home and more supports are needed. So how to broach your concern and how to bring up these topics. I always say speak from the heart. Mom, what keeps you up at night about your living situation? What do you think is working well? What do you think is working less well? Mom, I'm concerned about the number of falls you have had. I worry that one of these times you will hit your head, lose consciousness, and lay here alone for hours or break a hip. Let's talk with your doctor about needing blood work, physical therapy to get you stronger, a medication change if you are getting dizzy or lightheaded, and maybe that's what's causing the falls. There are fall pendant solutions that would give me peace of mind as your daughter. Home care can help with difficult chores like making their bed, housekeeping, laundry, meal preparation, and running errands and transportation services. And think about, is the home even senior safe? Dad had another fender bender. It's time we discuss this. One, about driving. I always say, because obviously this comes up a lot, especially here in Florida, that there are hundreds of people that should not be driving. So one thing I say to the families is, would you trust your favorite grandchild in the back seat of the car with your dad driving? If the answer is no, then we have to go on to some other solutions, and it may involve calling the doctor and getting the doctor involved, or having Department of Motor Vehicles involved as well. So that's always a tricky topic. Caregiver fatigue, the last topic that we'll talk about. Caregiver burnout is real. It's preventable when an aging plan is in place. Many seniors feel they are not honoring their wedding vows by having someone else take care of their spouse. I've heard that my entire career. Well, I married her and I told her in sickness and health. So they take those vows so literally that they won't allow home care or sometimes their own family to help them. So that's a whole nother that's a whole nother conversation that's not going to be covered just on a quick little webinar. Many caregivers do not ask for help soon enough. Then they get burned out and they resent their family. Sometimes this is on the shoulders of the caregiver because they don't communicate right away and say, hey, look, I'm getting burned out here. I need help. I'm overwhelmed. Their care needs are more than what I thought, or mom and dad aren't doing well. And now my husband's parents are sick and I can't juggle everybody. I have daughters that are taking care of up to 6 aging loved ones, their parents, their in-laws that they may or may not have liked in the first place. And then that stray aunt or uncle who either outlived their kids or never got married. And so they're like, oh, Sally can take care of her. She's doing such a great job with all the other elderly people in our family. And I'm telling you, that is a good way to burn your bridges with your loved one. Caregivers get sick more easily and for longer periods of time. They're just worn out. They're in survival mode. They're just trying to make it through their day. And sometimes they don't really realize how burned out they are until their loved one is in the hospital and they're like, oh, I can actually sleep through the night. And then they feel guilty about feeling that way. Short-term caregiving is much different than long-term caregiving to a frail or demented loved one. It's one thing to take care of mom because she has a broken hip and in 2 to 4, 6 weeks that it'll get better and she'll be hopefully back on track. But when you have a frail elderly loved one and has dementia, it is a 24/7 job. It will be a 24/7 job. So you have to have conversations and you have to put a plan together. If left unchecked, families will fall apart for generations to come. And as a social worker, that truly breaks my heart because there's no reason for these families their relationships to disintegrate because of the aging process if we can reach these families sooner rather than later and put a plan together. Caregivers are leaving the workforce and they're jeopardizing their own finances to become family caregivers, which again is an unpaid position. No insurance, no benefits. It's a financial strain for those that don't have a plan in place. Caregivers neglect their own needs and they become resentful. I have a lot of Ethels that are supposed to be getting hip surgery, but they can't because they're the caregiver to Marvin, who has dementia and counts on her to be the caregiver. So she's not getting her own surgeries because she's the caregiver and she doesn't know that there's other options. Because if she can't take care of herself, she's not going to be able to take care of him. So caregiver fatigue conversations, how to open up the doors to these conversations. It's okay to admit that you're struggling. We're all human. We all have a capacity limit, right? We all have a finite amount of time and energy and ability to be able to help others. You can say, I need more help. I'm having a hard time juggling everything that I need to do. I love you, but I don't know what is best for you. We need help sorting out our options. Dad, you've lost weight and always look tired. I know mom needs a lot of your time and attention. Let's talk about what our options might be. And you probably don't know what the options are. That's why there's people that can help you facilitate these meetings and put options in place. John, this is the 4th time this year the kids have had to leave work and come to our rescue. We can't keep doing this to them. My doctor told me I can't keep putting my own surgery off. We need to discuss getting an aging plan now. Conversation starters again, just reinforcing this. Just leverage this webinar. Mom and Dad, I attended a webinar and it got me thinking about our family. What is our aging family plan for the what ifs? Leverage a medical crisis you have already endured and how uncomfortable and scary it was. Why wait until the next one to develop a plan? Mom and Dad, our family is an unfamiliar territory. We need help discussing and finding solutions. Dad's dementia has worsened. What are we going to do? Mom is burning out. Dad, we need to figure out how to best help her. Mom and Dad, is it important to you to have choice and quality as you age? If so, then we need to talk about it and put a plan together. So ask yourself, what keeps you up at night? What conversations have you had as a family about the what ifs? How confident are you that your family gets along well enough to facilitate your own family meeting? How confident are you that you are knowledgeable enough to develop your own aging plan? Are you clear on care options and how care will be paid? Medicare does not pay what families think it will. It is not a long-term care insurance solution. Do you know the difference between independent living, assisted living, and memory care, and skilled nursing, and skilled rehab, and adult day programs, and home care? Are you an expert in those areas that you really feel confident that you can develop your own aging plan? If there is a medical crisis today, how prepared are you and your family? If you got the call right now that your dad had a stroke and you're the healthcare and financial power of attorney, do you know everything that you're supposed to know and where these documents are? Because you have to prove that you're the, the decision maker. How confident are you if you had that call today that there was a medical crisis that you're prepared enough? I can tell you that when you're in crisis mode, emotions are high, time is limited, and you do not have the luxury of time to figure out what you're going to do. You have to make big decisions quickly. So it's prudent to do this ahead of time. Where are the gaps in your planning? And is all of this overwhelming? Like, have I totally overwhelmed you with all of these different conversations and points to ponder? So we'll take some time for questions and answers.
In the chat box. First, put my eyeballs on so I can see here. What are some of the ways to help an aging parent accept that they cannot drive anymore? Despite 3 incidents of getting lost, accidents, and having her license suspended, my mother refuses to accept driving is not safe for her or others on the road.
Yep. So this only happens about 2,000 times a week with families. So these driving is a difficult conversation to have. And I'm here to tell you that when when families try to have these conversations and meet with their own loved ones, the relationships get even more strained because it's hard to keep the emotional junk, the emotional feelings out of the conversation. So again, that's why there's the value in having a neutral third-party person facilitate these family meetings and talk about all of these things. You can leverage the physician and say, look, mom's had these accidents, she's getting lost. It's likely that your mom has memory impairment. There are different technology solutions like GPS trackers you can put on her cell phone if she uses a cell phone. You can also put these GPS trackers on the car until at least you figure out what the strategy and what the solution is going to be. People don't like learning that they shouldn't be able to drive. One of the things I do with my families is I say, if you're local, walk around the car when you come visit to just see if there's any new dings in there, because that will give you some insights on how well they're able to drive. But if you're not able to have these conversations and have these conversations go well, you need to have a neutral third-party person facilitate these meetings, and that might be the doctor. Obviously, I'm a resource, but you've got to address these issues sooner rather than later, just for liability and not wanting someone to get hurt.
Yeah. Even to buy time, you might make sense to review your auto coverages and make sure they're adequate, because those coverages will protect those assets that you may need to pay for care. So having the proper coverage in case there's a liability issue so that those assets are protected is pretty important. I'd recommend reviewing that coverages on your auto coverages and homeowners.
That's incredibly important, because I don't know about in other states, but in Florida, people are getting sued because they know they're a known unsafe driver, and so you have to protect your assets. So look at that insurance coverage and make sure that you've got proper coverage until you or me or whoever you use to help you can figure out a plan.
What do you recommend to people who don't have adult children to help when they get older?
I know. So that's that's a challenge. I'm going to be in the same position because I don't have a family either. And that's a big challenge. So usually what you need to do I'm assuming what they're talking about is who can I appoint as a power of attorney? So if you have siblings and you trust them, or you have friends, you can leverage your friendships and say, hey, if I can't make my own decisions or I get sick, will you step in and be my decision maker? But you have to make sure you communicate what your wishes are. If you have no one, because there's a lot of seniors that are really isolated, they outlive their kids or they had no kids, then they're hard to find, but there are professional decision makers that you can leverage. But you have to pay for that, of course. But there are professional decision makers that you can pay to become basically your guardian and your decision maker.
Looks like we're getting into a Medicaid kind of question here. What if my parent doesn't have financial resources for the amount of care they need?
Yep. So there's a lot of clients I work with that are in that boat, or some of my clients are in that boat. So that's why you have to put an aging plan in place, because you need to know where you qualify to get in for care, which facilities are options for you. Most skilled nursing centers or nursing homes, what we used to call nursing homes, they limit their beds, so they limit the capacity that they can take in for Medicaid. So that's why you end up with one parent in one facility and the other parent maybe 2 hours away, because maybe those are the two facilities that ended up having a Medicaid open bed, and they didn't have one together, and then your parents end up separated. So those that have limited financial resources, it's imperative that you put a plan together so that if you do have two parents, that hopefully the goal is that we keep them together in the same facility. But you need to start that planning process now. In general, just so you know, to get into certain facilities, you have to financially qualify. So you have to have a certain amount of money to get in. And if you're looking at that Medicaid piece, there are some facilities that you can move in right on Medicaid, like already on Medicaid, but many of them require 3, 6, 12 months of private pay before they'll let you move in. So those are important conversations that we need to have now and put that plan together and get on a waiting list.
Yeah, they may want to even look if they have any type of older life insurance policy. Sometimes they can have a chronic illness rider benefit on there that can help pay for care, buy them that time.
Mm-hmm.
Do you recommend any sort of written agreement with parents if they come to live with you?
I do, actually, just like a rent agreement, right? So I do. I know that we talked about like privacy and the house looking and smelling like a nursing home, but what we didn't talk about is who's going to pay for what. And that is, at the end of the day, what families end up fighting about is, well, especially if when it comes to inheritance, the family caregiver who took them in says, I should get more because I gave up my life to have mom and dad move here. You have to document, and I tell families you have to run this like a business, and not to sound cold about it, but you have to run it like a business, because you don't want your family to fall apart just because you didn't have the meeting and didn't have conversations and documentation. So if you pay for anything for your parents, put it on a spreadsheet. If anything comes out of your own pocket, or if you're saying, yep, you can move in, you guys pay the mortgage, I'll take care of everything else, or I'll pay the mortgage, you guys pay everything else, you have to have it documented. I encourage that you have it documented, so there's no ambiguity about the arrangement that you have. I know it sounds formal, but I'm here to tell you, as a mediator, many of my cases that come to me, it's because of the finances, because they didn't talk about things and have an outline of who's paying for what.
Yeah, I've seen a lot of family squabbles over money, that's for sure.
Yep.
Last question. How has COVID-19 impacted your work with caregivers and aging parents?
Oh, well, it's actually apparently takes a pandemic to wake people up, or wake families up, to say, hey, look, mom and dad could be vulnerable here and we can't travel to go check in on them. What are we going to do to help them be safe at home if they're still at home? So the pandemic has made families really step back and think about, what is our family plan if mom gets COVID and we can't go in to visit her in the hospital or in a facility? So a lot of my clients, if they have the funds, they have been keeping their loved ones at home, layering in with home care supports. Family, if they're local, they've been assigning themselves shifts to be able to take care of mom at home, with the plan being that when consumers feel more confident that they can move their loved one into a care community, then they'll do that. But how it's affected families and me, with the aging plan, is how comfortable are you having your loved one either home with home care, or how comfortable are you having your loved one move in with you, or how comfortable are you having your loved one move into a facility and really literally dropping them off at the curb, not knowing if you'll ever see them again. These facilities, I will tell you, have been completely overwhelmed. The quality of care in these facilities since COVID has been astonishing. So you need to learn how to be a patient advocate. I teach that. That's part of what I do with families, is patient advocacy and how to teach families to be their best advocates. COVID has definitely made a huge impact on kind of forcing families to think about these what ifs. All the things that we talked about in this webinar is forced families to think about it and put a plan together.
Okay. Thank you, Annalee.
Yeah, thank you.
Annalee, I'm going to go ahead and let you speak if people want to reach out.
Okay. Yep, there's my contact information if you have questions or want to schedule any time with me to just kind of go over this information that we talked about, or if you want a copy of the slides, I can send them to you if you reach out to me. But that's my contact information if you have any questions or any of this kind of hit home for you and you're like, oh, what are we going to do? So I'm available as a resource.
And I want to thank everyone who's been a part of this webinar today. Thank you, Annalee. Thank you, Alex. On behalf of Advice Chaser, we really appreciate your expertise. And we thank our attendees for attending. Look for an email with a link to the replay of this event. You're welcome to share that replay with your friends or family. Here at Advice Chaser, we're all about helping you find a financial advisor who is a great fit for you and your family and your financial questions. Our matching service is free to you, and every one of our advisor partners has committed to offer a free initial consultation to anyone we introduce them to. Find out more by going to advicechaser.com and clicking on the link to find an advisor. Once again, from Advice Chaser, thank you so much for coming, and we'll see you at another webinar soon.
Thank you.
Bye.
Thank you.